Hi, I'm back. Sorry for the break. I got into a little bit of a car accident, so I was out for a little bit. But anyways, I'm back. I had some people contact me in regards to several questions on diagnoses and things like that. And one prominent question was about fibromyalgia. Now, for clinicians out there, I know you're probably familiar, but I'm going to talk about it anyways before we get into the Iastm portion. For those who are not entirely familiar, fibromyalgia describes a disorder having to do with the musculoskeletal and nervous system. Basically, it includes symptoms such as fatigue, decreased sleep, decreased memory, mood swings, stress intolerance, exercise intolerance, and a constant dull ache that lasts for usually 3 months or greater is the criteria. Uh, the pathology deals with central sensitization. Now, that's a big long word for saying your body is hypersensitive, especially to pain, touch, pressure. Um, there are certain points that are also used in the diagnostic process that are usually more tender than others. And I'm going to lift this up so I don't go down the list. These are the common points that are oversensitive or extremely sensitive to touch that produce a high pain sensation. Um, there are usually you have to have 11 out of those 18 points along with other diagnostic criteria to be officially diagnosed with fibromyalgia. And in many cases, they use differential diagnostic processes to rule out other disorders rather than testing just for fibromyalgia. So before jumping on that wagon, go to your doctor and make sure that this is something that is of concern, um, if you're curious. Now, people who are diagnosed with fibromyalgia, unfortunately, are typically deconditioned. One, because of their poor tolerance to activity, their increased sensitivity to pain, and also lifestyle choices. So once you're officially diagnosed, there are several forms of treatment and lifestyle changes that are usually attempted in hopes to improve your quality of life. Um, there are cognitive therapies, behavioral therapies, physical therapies that are used to treat and manage a lot of the symptoms that go along with fibromyalgia. Uh, Now, we talked about central sensitization, which means you're very sensitive to pain. Your body doesn't really know how to process a pain signal, or it produces one when really there's no pain. When it comes to treating that, usually desensitization techniques are used, and that can be in the form of uh, different surfaces such as sharp, soft, hard, you name it, cold, warm, uh, but also just getting used to the idea and feeling of touch. Now, relating to Iastm, my passion in the world right now, besides helping people, Iastm can also be used for treatments for fibromyalgia. Hugely desensitization. So my go-to tool for desensitization processes, try to say that 10 times fast, is the blade. All right, here's the scanner. You can see it's single bevel, if it's not too fuzzy for y'all out there. And I don't have a patient with me, but we'll use my leg. My leg gave me permission. Normally, I start with really long strokes. So you can kind of see, and I'll move this a little bit so you can see better, hopefully. Just grab it nice and gently. And again, I don't go exactly on the point that's sensitive, and typically for fibromyalgia patients, that's around the knee area, especially medial knee. Gently, with very little pressure, if any, just go up and around the area. Okay, you don't want to start with the bevel facing at 90 degrees. I mean, one, that's going to be uncomfortable anyways, but that's like the most intense you can get. The flatter you have this, the more flatter, the lighter it's going to feel for the patient, the less you're going to be able to really read necessarily, especially deep tissue. But we're not working on breaking cross links or adhesions or anything like that right now. This is desensitization, which is entirely different than if I had a knot and I wanted to break it up, to reset it. You can also do short strokes. And as the patient becomes tolerant, you can increase the angle. So this is flat. You can increase the angle off of the skin, making it a little bit more intense. And there's a bunch of stucco in my leg. Okay. If you have one specific area that maybe needs a little bit more than other areas and you want to be a little bit more finite, you can use the tongue depressor. Now I'm going to go with the knee. I don't recommend it for new patients, especially when you're working with desensitization, there I go again, techniques, because this is pretty deep and it's pretty localized. So if you're looking to just make everything less sensitive to touch, this isn't necessarily going to be your best friend. However, you can go up very specific points in the chain. Feels good. Or if you're done with the scanning and you want to go into more breakage, it's the perfect tool to go to. Some people like a little boomerang better. It's kind of the same as the scanner. It's single bevel, but I find that I can get a little bit deeper with this tool, and well, the handle's a little bit bigger. You can get wider areas for one. When it comes to the neck, elbows, knees, they're all very, very sensitive points. You can still use the scanner. Again, watch out for changing the angles. So lesson behind this whole thing is, for desensitization, flatter the better to start with. As you come up, it gets a little bit more intense. Longer the strokes, the better, starting away from the really sensitive areas. So a lot of fibromyalgia patients are really sensitive medial knee, but not distal leg. Okay, so if you start down there and everything's fine, maybe have them look somewhere else so they don't get overstimulated by visual and tactile feed in sensations. That might be better. I would also think about being careful with the warmth and cold prior. That is a judgment call to be made with fibromyalgia patients. And this is speaking to you patients as well. When your physical therapists have you warm up on a bike or something, that is kind of the same end goal for us prior to this treatment as a heating pad. However, fibromyalgia patients, there are dozens, hundreds of studies out there that show that an increase in activity, despite what you would think, actually helps to correct that altered manifestation of pain processing. So the more you exercise, the better. And physical therapists, that's kind of our thing. We want to help you with the manual treatments, with even modalities as necessary, but getting your body to function the way that it should via exercise, activity, education, that's also a strong goal. So after desensitization, a lot of times moving to something more for cross-link breakage or adhesion breakage, like we talked about. Then moving on to gentle stretching to increase range of motion, and exercise to help build strength for activities of daily living. This is the normal process to be followed. If you have any questions, please don't hesitate to contact me via YouTube or whatnot. But moral of the story, this very long story, is these tools can be used to help correct a lot of diagnoses, fibromyalgia included. There's not a lot of research right now specific to fibromyalgia, other than it's a cluster of these very specific symptoms. But I would ask your provider if they have used Iastm, if they're educated, especially if they're educated, to see if this can be a form of treatment to help improve your daily life. So I hope you enjoyed it. And again, please contact me with any questions or concerns.